Now, as you know, this is an older cat, but one thing you might remember is the aorta comes off of the heart, and this is it. You can see where the latex, the dye, is actually inside of the aorta right here. See that? They inject it where it shows up, else everything looks kind of like a big brown blob. It's hard to tell what's what. And you can see the intercostals coming off along the aorta here. But the aorta continues on down. It pierces the diaphragm, but it's so thick that it's just kind of hard to see it, but it's coming down right here. I don't know if you can see it. See this big white thing coming right here? Okay. Now, there are two major branches that come off of the aorta. There's this one that's called the celiac trunk, and there's this one that's called the superior mesenteric. The celiac trunk has three major branches you have to know. One goes to the liver, so it's called hepatic. One goes to the stomach, and it's called gastric, and one goes to the spleen, and it's called splenic. Actually, there are about 5 or 6 branches that come off, but the three biggest are the ones you have to know. And let me see if I can find the 3 branches. Oh, yeah. Here is, well, actually, yours comes off a little strangely. Here's the one going up to, make sure I got this right. It's hard to see. Can't tell if that's going to the liver or the stomach. I would say this is going to the stomach. This is gastric, and then this one branches and goes off to the spleen. See, it's got a couple of different branches, like this is going to this part of the spleen, and this goes to this part of the spleen. That was a splenic branch. And I don't really see a hepatic branch. Sometimes they just come out fine, and sometimes they don't. It could be that it's just branching funny because of this. That might be it right there that branches that way. Alright, Tim, since you're recording, let's just not find the hepatic on this one, because, like I said, I'm not seeing a very good hepatic on yours. But the ones that go to the stomach are called gastric, and the ones that go to the spleen are called splenic. Alright, continuing on, this is superior mesenteric, and then the next thing that comes out of the aorta is this one that goes to see this little gland that looks like a little pea right here? It has this big vein going across it right there. That's the adrenal gland, and in cats, in us, the adrenal gland pretty much sits right on top of the kidney, and the cat is a little more medially located. But anyhow, this vessel has 2 names, and I like the name adrenal lumbar because it goes across the adrenal gland and then continues on to the back. But some people prefer the name suprenal because it means above the kidney. Do you see how I have 2 different names for you listed there? The next big one goes off to the kidney, and you might remember the combining form for kidney is renal. And there's the vessel right there. It's kind of dried up and it looks smaller than it should. But that's it right there. The renal artery, right. So guess what the vein is?
Renal vein?
Yep. Okay, so now you can see that aorta continuing on down. See it continuing on down, and it finally splits way down here. You see that? Okay. But let's take a look. Our next branch after you pass the renal artery that went to the kidney is this one that goes off and goes to the gonads. And in females, the gonads are ovaries, and males, the gonads are testicles. So you can actually call this either gonadal, or you can call this one ovarian. And see it going off here and here. And here is some dye leakage. Here's the ovary right here. That little teeny bean-shaped thing right there is the ovary. So this artery is taking blood to the ovary. And then here's the other one going to the other ovary. Okay, the next branch goes off to the large intestine. And here it is right here. This is called the inferior mesenteric. Mesenteric are all these coverings in the abdominal cavity, and that's where you get those names. Okay, the next branch usually runs perpendicular this way to the aorta, which is this way, and it almost makes like a T. And that's called the iliolumbar. Ilium, like part of your hip bone, remember that? And lumbar for low back. Finally, you have the vessel split into external iliac here and here, and internal iliac here and here. Some people say that in a typical specimen it looks like a little Y inside of a V, and the outside V is external and the inside Y is internal. And I don't know if your person's dissected out caudal is optional. I try not to, there it is down deep. You see that red one down real deep? Real deep?
Oh, yeah.
That's caudal. And I eliminated deep femoral simply because it just ends up that we have so many very pregnant cats that if we move it around too much, we mess up our reproductive system. So you see how that's in a different print, both the caudal and the deep femoral. But one other one you do have to know is this big one in the leg, runs next to the femur, so it's either called the femoral or femoral. I've heard it pronounced both ways, femoral or femoral, or the femur right there. So guess what the vein is?
Femoral.
Yeah. Okay. Anything goes. All right, here is the first branch that you have to know in the veins is called the adrenal lumbar.
Okay.
As one of your classmates pointed out, the adrenal lumbar arteries are so puny in some of the new cats, it's not even italicized. But in any event, there's the adrenal lumbar vein, which does show up very well. Here's the renal going off to the kidney. Now notice there's this weird one that drains into the kidney right here. And that's just kind of one of those weird strangenesses where the veins branch a little differently. And on this side, on the cat's left, the gonadal, which in this case is the ovarian vein, drains into the renal instead of draining directly into the vena cava. On the other side, however, it's right here, and the gonadal's draining directly into the vena cava. So just don't let that mix you up on the test. Okay. All right. The next thing you have after the adrenals that you can see in our pathway is this one, called you know that one from the artery, adrenal lumbar. Sometimes when I pin it on test, I just kind of stick the pin right here and ask for either the vein or the artery, since they have the same name and run parallel to each other. Finally, the vena cava splits, and yours splits a little higher than they sometimes do, because yours split about right there, and you see how there's one V that goes off to the left and the other V goes off to the right. That's called the common iliac, and it'll eventually split into internal and external iliac, but you don't have to find that. In this cat you might be able to, but again, we've got so many that are just so terribly pregnant, I didn't want us moving it around too much. The other one you have to know is this one, called femoral, and you have to know this one that's superficial, called the great saphenous. It's very important because it is superficial and it's very long. They're able to kind of rearrange it, stitch it back together, and take pieces of it and use it for cardiac bypass. Of course, in this cat that wouldn't work out since it doesn't have a heart anymore. Other things you can sometimes see, the superior mesenteric vein running along the colon. Depends on how much. There it is. They don't take dye. The hepatic portal system doesn't. But there's part of it right there. It's brown. See it right there. But anyhow, this is called the inferior mesenteric vein, and it's going to route the blood up to the liver for processing. Remember that with the portal system? And then sometimes you can see the superior mesenteric vein. That looks like part of it right there, running close to the superior mesenteric artery. And they all come together and form what's called the portal vein. It's like part of the formation here. Usually, though, if I pin it, I'm going to pin it up in this conglomeration up in here. Let's see if I can get to it. I'll pin it up in here as it goes into the liver. And it doesn't show up very well because, again, it doesn't take dye. I'm trying to find it. I've gotten torn. Here it looks like it right there. Right there. Running behind the gallbladder, going up. Right there. Portal vein. All right, so we've done the veins.
Cool.